All right, guys. So what we got today is the operational environment brief case presentation. Looking at the operational environment by definition, a composite of conditions, circumstances, and influence that affect the employment of military forces and bear on the decision of the unit commander. So everything that we're seeing with our military right now, the cancer, the suicide, the traumatic brain injury, all those things are coming from the environment, but commanders are not fully aware of that environment and those hazards. So this brief is going to be a major clarification of the operational environment, so everyone has a clear picture, situational context, and situational understanding of what's happening and why these things are happening to the force and why we're losing so many. Looking at it on the second slide, you guys see this path right here. We have chosen in the present full of hazards, as all paths are. The cost of freedom is always high, but Americans have always paid it. And one path we should never choose as the path of surrender or submission. So what is this saying? That there's hazards in our chosen profession. We know those hazards, we accept the risk, but the big thing right now that we're seeing is that the risk that's not being accepted is the one that's killing our service members that people don't know about, the cancer, the suicide, the CTE. All of those things are risks that people aren't fully aware of. So this brief is to take out that guesswork and empowers people to make better decisions and helps commanders create better safety tools and implementation to protect the force. Looking at it, the soft imperatives, this is the Special Operations Forces imperatives. Number one, right off the bat, understand the operational environment. So this is something that's in our doctrine, it's in our literature, that to go anywhere in any type of combat environment or training environment, you have to understand the operational environment. Why? Because if you don't, you go into that unprepared and you will pay the consequences. So looking at all those, everything highlighted in red is something that applies to the medical field as well, especially facilitate interagency activities. Prior to September 11th, none of the intel agencies cooperated. They were all compartmentalized. They didn't share information. Our enemy knew that. They took advantage of it, knowing that each one of them had a piece of the puzzle and had some of the information, but they didn't put it all together. So there was a huge vulnerability and they capitalized on it. That was September 11th. So after September 11th, everything became full systems, full integration. We had one head of all 16 intel agencies, and it facilitated sharing cross-culture information. And so people could get all the latest information to protect against a threat. So that's why that's up there as well. So here's the agenda. I'm not going to read this out. I'll let you look at that for a couple seconds. And then I want you to look at the top right, and this is the 4 steps of intelligence preparation of the battlefield. This is a tool that we use in special operations and the regular military to prepare to go into battle for mission analysis. Step number 1, right off the bat, define the battlefield environment. Describe the effects. Number 2, evaluate the threat. Number 3, and then number 4, determine threat courses of action. So right here we have a simple tool that can be applied into medicine, but step number 1 is define the battlefield environment. Your environment, your lifestyle, your genetics, all those 3 influencing factors play a huge part on the outcome of what happens to your health. So taking a military tool and a teaching aid and turning that into the medical field. And below that, you have the operations process. Step number 1, again, understand the operational environment and the problem. Frame your problem. You can't fix a problem if you don't frame it. And then step number 2, visualize the desired end state, the operational approach. How are you going to solve this problem based on what the problem is and what you have available to do it? And then step number 3, describe the commander's visualization in time, space, purpose, and resources. What do we have in our toolbox to do this? And then step number 4 is direct. So we start executing, we plan, we prepare, and we execute. And then throughout the entire process, we assess, and then we're always leading. But think of about medical terminology, assessing. We do it with our equipment, we do it with our equipment, but what we don't do it with is with our personnel, with our humans, constantly assessing their health. So that's why this is important. This framework we're going to take from this brief and apply it to medicine. So looking at patient background and lifestyle and environment, this is not looking at a resume, this is not looking at awards, but what everything on this slide shows is a story. Each one of those medals, each one of those badges, each one of those stripes, they all tell a story of where that person was, what they've done, how long they've been doing it, to what level they've been doing it. all of this plays a part when dissecting a patient's medical history and going back and reversing all those 20 years to 30 years of medical injuries and illnesses and deployment locations and putting them in a timeline. So if you look at the bottom, all those specialty skills, those are extreme environments. Those heavy breaching, explosive breaching, millions of rounds shot, static line jumping, jarring of the body, extreme environments, whether it be hypoxia at high altitude or hypoxia, at depth or training for dive school, or breathing 100% oxygen at depth with O2 toxicity. All those things, all those schools, they speak of some type of medical exposure. So that's why we put these up here. So when a patient or a person walks into a room and they the doctor looks at them like, oh, you look fine, you look healthy. They don't know the story. They don't know the background of what that person's done and what they've been exposed to. So that's why this is up here. Looking at the patient timeline, medical history, SIGACs or significant activities. So these are things that it's a term we use in the intel world to plot out patterns of life or patterns of function or types of attacks that are happening. For example, if IEDs are going off in the same place at the same time, that builds a pattern of activity that we see. It's regular. So same thing happens with your health when you go into certain environments, certain countries, and all of a sudden those symptoms and check engine lights start coming on. They start to build a pattern. Types of medications used or concussions, all those things tell a story. And you can see all the things highlighted in red. Those are deployments and deployment locations. So I'm not going to go into depth on these things, but the bottom line is you have to make a timeline with your patient. And as a person or as a service member, it's good to put all these things down because it starts painting that clear picture of significant activities that influence health. So looking back in here, 2012, this was actually my patient intake. When I first, after 2007 till 2012, I was battling health. I was dragging a dead body. But you can see underlined in red, it's fatigue, irregular bowel function, decreased sex drive, headaches, balance problems. I had all kinds of weird stuff going on, GI, massive fatigue, lethargy, all those things. If you look under it, it says no clear etiology to correlate all of his complaints. This is what the intent of this brief is so you have complete situational context of what's causing these health issues. So feeling tired and poorly tiring, easy, and lethargy, that got written off as fatigue for myself. So I was never asked what I did for a job, where I was working, where I had been deployed, and stuff I had been putting in my body. It literally was, what is your complaint right now and what type of drug can I give you to make you feel better? And that was all that was being offered at that time. So looking at it, after 2012 and finally giving up with military medicine, sought functional medicine help with actually Anthony Beck at first. And then he ran advanced diagnostic testing on me, found out I was packed full of heavy metals. I had inflammation top to bottom, leaky gut, neuroendocrine dysfunction, hormone imbalances, and I finally got MRIs and found lesions in the front of my brain, also on my pituitary gland. So I fixed all that stuff with functional medicine, got back operational. I dodged medical retirement and went back and did 4 more deployments since 2012. So, proof is in the patient. You can fix things, but you can't fix a problem if you don't know what the problem is. So if you look, you'll find these things, and we'll cover that coming up here shortly. So looking at the environment, this is right here, the National Institute of Health, looking at their environmental studies of how the environment affects biology, how it affects your health. And if you look around the tree on there, you see stress, bacteria, viruses, radiation, heavy metals, ozone, air pollution, endocrine disruptors, tobacco, pesticides, and then all your chemicals that you found in household goods. All of these things affect metabolism. They affect energy production. They affect DNA repair, DNA synthesis. So these are important to know because up until recently, your environment wasn't really considered as part of your health outcomes. Looking at the operational environment with cancer, suicide, TBI, and post-traumatic stress, look at the environment, look around you, where you're going. All those things are influencers, right? If you remember the operational environment definition, looking at, the top graph, aging, sugar, processed foods, sedentary lifestyle, environmental toxins, radiation, sleep deprivation, inflammation, hyperglycemia, nutrient deficiencies, and genetic predispositions. These are all external influencers that affect your metabolism, your mitochondrial function. So when those things are in abundance and overwhelming and the body can't keep up, you end up being in dysfunction, and that affects metabolism. And what we see on the bottom with that chronic inflammation, that metabolic dysfunction, you see all your chronic illnesses and diseases. And if you look on the very outside of all those slides, that was my environment, working in the most highly polluted environments, under the most extreme conditions, and breathing in the most horrible air pollution and toxins from weapons and explosives that I was working with. Looking at heavy metals as one of these sources, just looking at this right here, this reference comes from CTTSO. These people develop all the ammunition and weapons for the DoD and acquire them. And you can look, there's over 14 toxic metals in our munitions right here, mostly coming from propellant and primers and a little bit from the projectiles. But this is significant right here because without even going into any environment overseas, just working organically at home with your own weapons, you're being exposed to probable and known human carcinogens. And there's no research needed to prove that these things do cause cancer or can cause cancer. The research is already done. So what we need to look at is what extent are we being damaged by breathing these things in, not if we're being damaged. Looking at it, picture says 1,000 words. That's one artillery round going off. You can shoot 100 of these things a day. You can see the cloud of, toxic metals coming out the end of that barrel and then raining down on every single person there. They're breathing it, they're touching it, it's being absorbed in their skin, it's in their mouth, their nose. All their equipment's contaminated and the entire environment around that area is contaminated. That stuff does not come out of the environment unless professionally abated. So looking at other sources of exposure, looking at heavy breaching, doing the same thing for me specifically. You look at all these rounds. When you walk into a doctor's office, you said, I ate 40 charges. The provider is not going to know what 40 charges means, let alone one charge. So to give you an idea, one charge of a breaching charge is the equivalency of a quarter pound above of plastic explosives. And you're anywhere between 6 to 13 feet away from this. And most of the time it's in confined spaces. So that's why that's really important to understand what one of these things is. But you can see in a 2-year period working at the range facility I was working at, I was exposed to 2,400 of these things just as an instructor. So that doesn't count anything operationally, nothing else in training as a special forces operator. This is only as an instructor. But this memo on the right-hand side, it puts a time, location, duration, and a type of what I was exposed to, and it gives me something from my records to show a medical provider this is exactly what I had been exposed to in this environment. So it's really important because a lot of times providers will say, well, this is not really important because if it was, we'd be doing something about this, or it'd be bigger on the radar. But the fact is that these things are in the environment, these carcinogens, plus with blast overpressure on top of it, you're not immune to this. It's cause and effect. If those things are in the environment, you go into that environment, they're going to have an effect. To what extent depends on the individual, bioindividuality, age, body composition, genetic predisposition, time, duration, location at these places, or what type of job specialty they have. So looking at it, the lead in the shoot houses on the left-hand side, you're going to see lead levels by OSHA standards recommended 200 micrograms per square foot. And you can see right up in here, this is 13,000 micrograms per square foot. So we're hundreds of times over the threshold. And there's no safe amounts of lead in the environment. There's no safe amounts. So looking at ammo expenditure in these facilities that have been used for 20 plus years, 150,000 rounds a class. And I did 16 classes, 14 as an instructor, 2 as a student, all within a 3-year period. And just by while I was working there, we're talking over 3 million rounds with all these heavy metals. The lead study is only showing one metal. It doesn't show those other 13 toxic metals in the munitions, by the way. So looking at it, this is, shooting heavy machine guns. You can see that cloud. You get a blast overpressure wave coming at your face. Also, you have a toxic cloud of gas that you're inhaling all day. and then you, your equipment, your skin, and your vehicles are contaminated with carcinogens. So everything that you touch, handle, or bring home, it's all contaminated. So toxic mechanism of action of lead. I won't go into detail on here. The bottom line is you have mitochondrial dysfunction, you have DNA damage, DNA disrepair, oxidative stress, excitotoxicity, ATP depletion, which leads to apoptosis. So you have pretty much the identical injury mechanism of action of the secondary effect of traumatic brain injury. So looking at the health effects of these metals that are listed right here, they're some of the common ones in our munitions. But you can look right off the bat with the carcinogens. You have lung cancer, you have brain cancer. Looking at every single organ system in the body is affected by this, especially the renal system at first, then cardiovascular, then the nervous system at higher levels. Then you end up with encephalopathy. Bottom line is cancers caused by carcinogens. You don't need research to tell you that carcinogens cause cancer, right? So this stuff is in the environment, it's in our munitions, it's in our weapons, it's all over the environments of the places we deploy to, and we're breathing it in and we're handling this stuff. So again, we don't need to do research to prove what we already know. We need to find out how much damage this is actually doing. So looking at fertility effects, we know that heavy metals damage sperm, especially lead causes motility issues and developmental issues with kids. Looking at this was after working in that range facility for 2 years. Once I learned about the effects of lead and heavy metals, that I put this up here to show you that, if this stuff's in the environment and you're working in it, it's going to have some type of effect. I learned that and went and looked what to look for and ordered the test. And sure enough, I had motility issues, and I was pretty much sterile at this point. And this was in 2013. This is 6 months after working in the range, by the way. So looking at it, neurological effects of heavy metals, you can see what this stuff does. That lead toxicity is pretty much identical to traumatic brain injury. So when you're looking at the toxic mechanisms and looking at all the symptoms, you're going to find out that they're pretty much identical. But the bottom line is neurotoxins cause neurotoxicity. Neurotoxicity affects the nervous system, and that's what you're going to see. So this is all the dysfunction that is caused by this stuff. If it's in the environment, it's going to have an effect. You need to look for it. Looking at lead in the blood, looking at how much lead is being accumulated in the bloodstream. If you look at the bottom of the slide, this was coming out of Afghanistan right here. I was literally back from Afghanistan for like 3 or 4 days and started in a shooting school for 9 weeks. I was already pretty much by today's standards at acute toxic lead threshold. And at the top, you can see after a few weeks in the school, I'm already 3 times over today's standard for acute toxicity with lead. So this stuff is in there. If you're working around it, your body's going to be absorbing this stuff. Looking at proximal exposures, learning that, after this stuff is found in the environment, we know it's in there when we're shooting. I learned that to get tested after I've been shooting, especially in confined spaces. And, if you do work in this environment, you're going to get some of this stuff in you. You can look at the top, after shooting for a few days, lead in the blood's already at 4. And then down here, you have arsenic, lead, mercury, all above acute toxic thresholds. So if you look for it, you'll find it. Looking at arsenic on a different lab after shooting again, you can see at the bottom, lead was at 6 micrograms per deciliter. And then you can see at the top, the arsenic is off the chart 3 times over the reference range. So it's in the munitions, it's in the environment. If you test people, you'll find it. All right, deployment cumulative exposure. So after being deployed 3 trips, it was decided that we should do some third-party testing just to confirm what all the other labs in the military and the Cleveland Clinic were showing. So I went to a clinic up by UNC, third-party testing. They ran more. This was provoked. And all the same metals that have been showing up in my labs were there, and they all exceeded toxic thresholds and showed body burden or accumulation over time. So it was detrimental to my health, and you can obviously see how it affects metabolism. So we're going to look at mitochondrial function real quick, and we're going to go over how these heavy metals, how these environmental exposures affect metabolism. So basically we have with Krebs cycle is how you convert your fats, carbohydrates, and proteins into usable energy. So how your cells can function and repair themselves and maintain themselves. And if you take anything like all these heavy metals on the side and they enter in the bloodstream, they affect your metabolism. So you can see all these red circles right here. These are all inhibitors of Krebs cycle, of metabolic function. And whenever you have anything that inhibits metabolic function, you disrupt your metabolism. So all the heavy metals you see elevated over here, they all play a part in your metabolism, and they cause mitochondrial dysfunction, and they cause metabolic dysfunction. So looking at metabolic analysis, breaking it down with a graph, here's a perfect one from NIH showing what heavy metals do. Basically, you have oxidative stress, reactive oxygen species. So what happens is if you don't have enough antioxidants and repair in your system, you become inflamed, you become in disrepair, which eventually leads to apoptosis, which is programmed cell death. So looking at the environment, this stuff is well established in the literature. We don't have to do more research to tell you what basic biology is already telling us. So the environment has an effect, it affects metabolism, and the bottom line, it causes DNA disrepair and dysfunction. Mitochondrial dysfunction affects metabolism and can lead to cancer. So it was determined that having that body burden of heavy metals in me was definitely affecting my metabolism. The risk was not outweighed by the benefit in this case. It was more beneficial to pull some of these metals out to check how it affected my metabolism. So I was chelated for a year with oral chelators first to remove mercury, and then I'd used EDTA for lead with IVs. So everything before everything was pulled out, everything was pushed in with nutrients and then stabilized, and then they would pull. So you can see after a year of chelation, the majority of the metals significantly reduced, but mercury was still elevated, and antimony. Antimony is actually in our munitions, and I was still being exposed to all this stuff while I was being chelated. So looking at environmental exposures and the health effects, especially with the lungs, I'm going to go in a lot with air pollution and lung damage, but just showing you that, you know, after your immune system's been affected by this stuff over and over, it starts becoming more vulnerable. And after shooting in a confined space for 3 days, I developed pneumonitis and then ended up with pneumonia and hacking up chunks of blood. But you can see this was prior to going to Africa. This is, you know, pre-mission training, working inside baffle ranges, indoor shooting ranges, developed lung problems. In my health from that period on, from my lungs to speak of, I've never been the same. So looking at the effects of mercury, mercury is known to damage the lungs, especially breathing in vaporized. But you can see at the bottom that just after shooting for a few days in an enclosed space, I already had acute mercury toxicity. So 10 micrograms is by standards the acute toxic threshold. I had already been exceeded prior to even deploying. So inhalation exposure, I'm not going to read this out loud. You can look at it real quickly, but if you breathe this stuff in, it causes mitochondrial dysfunction, DNA disrepair and damage, and it causes permanent damage in there. So this is really important because no matter what you do for cleaning your hands or doing anything else, you're still inhaling these things. So very important right here, because this can cause a lot of problems when your lungs start going out, starts causing a lot of heart problems. So, and sleep apnea, by the way. Worldwide mercury use, this is looking at mercury use for industrial and mining. These are the places that we deploy to regularly. You have Southcom, AFRICOM, CENTCOM, and PACOM. So all these places are toxic waste dumps. And mercury, besides mining and industrial use, also comes from burning trash and burning electronics, and a lot of light bulbs and a lot of batteries have these mercury in them. So toxic waste, they burn their trash in all these places. So you have to be aware that this stuff's in the environment, let alone your munitions. So looking at toxic inhalation of fumes, coming back from Africa, I was having lung problems, lung inflammation, and my O2 saturation was dropping significantly. And finally looked at it. Once I figured out what was happening with my lungs, I ordered labs to have them waiting for me. So the day I got off the aircraft, I was able to do my heavy metal testing. And you can see on the left-hand side that mercury was 30 times over the reference range. So this was done at the Cleveland Clinic, and lead was also well over 20 times. These metals were coming out of my munitions from training, but also from the environment and the stuff I was breathing in Africa. So you look for it, you find it. All right, 2 weeks after getting that test done for the military labs, I repeated labs once I figured out if mercury was that high and lead was that high in me, that it was causing renal damage. And sure as can be, we looked at it, creatinine clearance was almost twice over the reference range. And 2 weeks after being back from Africa, I still had acute mercury toxicity. And you can see arsenic and lead were still present in the system. No safe amounts of these things. On the right-hand side, you can see what renal damage does. It kind of looks like a hard night of drinking, but that is kidney damage. So lead toxicity symptoms, we're focusing on lead right now because it's the easiest one to find, and it's pretty much the only metal tested in the Department of Defense as far as the military goes. But if you look on the left-hand side, you'll see all the symptoms that either identical or overlap with traumatic brain injury. But this is neurotoxicity. Lead is a neurotoxic injury, and then traumatic brain injury is a neurotoxic excitotoxic injury. So bottom line with lead, it's almost identical to traumatic brain injury with the excitotoxic neurotoxic injuries leading to apoptosis. Lead passes through the blood-brain barrier, which does damage in the brain. Chronic and high lead level exposure leads to encephalopathy. So it might not be traumatic, but it's still encephalopathy. It's neurodegenerative. And probably human carcinogen, causes mitochondrial dysfunction, DNA disrepair. This is important because it can cause cancer. Lead damages sperm production and quality. So big takeaway on here is even if you don't care as an individual, you know, I love to shoot guns, I'm not going to stop this. But if you're taking those uniforms and equipment home, trace amounts of this stuff once it gets in the environment can cause miscarriage and birth defects and stillbirths. So just because you don't think it's a big deal, you can destroy your kid's life. So very important takeaway right here is looking at that. And it's neuroendocrine disruptor, it affects all your hormone production. All right, recent changes in acute toxic threshold from the 1978 OSHA studies. It used to be 40 micrograms and below you were fine. The acute toxic threshold was 40. That has been now lowered to 10 micrograms per deciliter. Huge takeaway in here, there is no safe amounts. Levels between 2 and 5 micrograms per deciliter cause permanent kidney damage and dysfunction. So we're not talking massive amounts of this stuff, trace amounts of this stuff. It affects every single system in the body. But most importantly, we're looking at the health effects of kids as well. So air pollution, environmental considerations, looking at these maps again. So we're looking at AFRICOM, we're looking at CENTCOM, and we're looking at PACOM. So all of these three areas of responsibility are some of the most polluted areas in the entire world. It's known that if you go into a polluted environment full of these toxins, that it damages DNA in up to 3 days. So you don't have to be there for 6 months or 10 years. Just being in these environments for a few days has the ability to cause DNA disrepair and dysfunction and damage. So bottom line is oxidative stress, inflammation, and damage throughout the body. You look at Africa, the places where I was coming out of working, my last 2 deployments, that's where I had the most impacts on my health, not in CENTCOM or Afghanistan. Africa had the most impact on my health. So looking at it right here, what are the health risks of particulate matter? Bottom line, decreased lung function, chronic bronchitis, increased respiratory symptoms, cardiac arrhythmias, heart attacks, premature death. It affects the respiratory system, damages lung tissue, and causes cancer and premature death. Pollution kills over 9 million people a year throughout the world, right? So here's a major threat. But I can tell you from personal experience and professional experience, this threat is not listed as something that is what's the word I'm looking for right now? A serious threat, a debilitating condition. Air pollution is not even looked at. We're looking at traumatic brain injury. We're looking at suicide. We're looking at cancer, but we're not looking at the causes. The environment's right here. We already know what this does. So this is something that needs to be fully briefed to every individual that goes to work in these countries or live. All right, burn pits downrange. So besides air pollution, we're looking at burn pits. We're talking man-made burn pits that we're throwing known toxins into, and then we are being exposed to these things. Recently, there's been major changes to not open burn trash and waste, but there are still places because of deployment circumstances that they have no choice, but they have to open burn it. A lot of people are getting respirators now, but one of the main takeaways from this is that host nation forces, they don't have an EPA, they don't follow any American guidelines, and they continue to open burn waste next to American forces. So it's still in the environment. Service members are still being exposed to this stuff. Looking at it, exposures, they kill more people than, poor diets or obesity or alcohol or accidents. This is one of the major killers in the world. And again, it's not being looked at as a serious threat. Looking at it, we're looking at 30%, 36% of these deaths from lung cancer, 34% stroke, and 27% from heart disease. Lung cancer, stroke, and heart disease, they are all connected. They're all part of one dysfunctional system, not getting enough air in the body. The heart has to work harder. It's an ischemic injury, and then the brain can't get enough oxygen, so your nervous system's in dysfunction, and your brain starts dying. So when you mess with one system in the body, all the other systems suffer, especially with the lungs and the brain and the cardiovascular system. Looking at it, on the right-hand side, you'll see the pathways of how this works. You're looking at oxidative stress, DNA damage, DNA disrepair, and then you're looking at your cancer. So this stuff comes in, it disrupts metabolism, it causes inflammation throughout the whole body, and that inflammation is slowing down your metabolism, metabolic dysfunction, and then around the outside of that human body you see there, that's almost every single system in the body is affected just by breathing in air pollution. Moving on to stress, we're going to talk about stress as one of your major influencing factors with health. And it's also one you can actually control, and you don't need a prescription to fix. It's just a little bit of education and awareness. So looking at being a product of your environment, how being in a stressful environment affects your health, and how your body adapts to it, and what stress inoculation does. But being in chronic stress, your sympathetic overactivation, that's your fight or flight. So your parasympathetic is your brake pedal, and your sympathetic is your gas pedal. So it's the go and the stop. It's the repair, the maintain, and it's also the breakdown, the wear and tear, which is the sympathetic side. So hypervigilance, that's easily startled, always being on the lookout, having to sit in the corner of the room, constantly scanning your environment, looking for threats, not being able to shut off work mode. When you're stuck in sympathetic activation, you can't do any repair or maintenance in the body. You can't digest, you can't absorb, you can't repair muscle or build muscle, and you can't clear toxins out of the body. And that causes a lot of problems, because if you stay in that catabolic wear and tear mode, everything in your body starts to break down, but especially your immune system. And then when your immune system breaks down, everything from your environment becomes a greater threat. You're more prone to it. And what does that lead to? That's the mitochondrial dysfunction, the inflammation, the DNA disrepair and damage, and then the cancer eventually. So bottom line, make sure, if you don't balance stress, stress will take care of it for you. You will be a product of your environment. You will be in dysfunction and disrepair. Looking at how stress affects the body and how it affects circadian rhythm. But looking at on the top left, you can see a normal circadian rhythm. Your cortisol is supposed to be the highest in the morning, along with your sex hormones. And throughout the day, it tapers off, so you're able to go to bed. But what happens is, after 20 years in the military, 15 years in the military, you start flatlining and your cortisol is low. What does that feel like? It's waking up in the morning and not wanting to get out of bed, feeling like you haven't slept. Also, you get all the aches and pains and everything. Your feet hit the ground, everything hurts in your body, and you have brain fog and fatigue. And you have to use massive amounts of caffeine to get through the day right here. And then by the end of the day, you want to melt in your couch and not move. And you don't want to deal with people, especially family or kids or anything going on. You just want everyone to leave you alone. And then by the end of the night, you finally get into bed right here, and then you're wide awake staring at the ceiling and you can't sleep all night. That's what happens towards the middle of your career when you hit the wall. You get adrenal insufficiency and endocrine insufficiency or endocrine dysfunction, and all your hormones are tanked and you become catabolic. And that's what you see over here. It's your anabolic catabolic balance. Anabolic meaning build and repair. catabolic meaning breakdown. So you can see these are my labs right here. I was redlined catabolic, wear and tear, breakdown, because I had testosterone of a 9-year-old and my cortisol was depleted. And if you look on the right-hand side, I was not able to repair anything. So that's your muscle loss, that's your weight gain, that's your fatigue, that's your low sex drive. So pretty simple, understanding how these hormones work and what they do. So looking at right here, this is a pretty great graphic to use. But the sympathetic side over here, this is your gas pedal right here. So all these things highlighted in red, when you keep that gas pedal to the floor, what's going to happen? You're going to be hypertensive. You're going to be, nervous. You're not going to be able to absorb or digest anything. You're going to be going to the bathroom 6 times a day. Your blood sugar is going to be chronically elevated, leading to insulin resistance and type 2 diabetes. And then you're going to be a nervous wreck because you're secreting epinephrine and norepinephrine. That's your adrenaline. That's what makes you anxious. That's what makes you nervous. That makes you more in tune to your environment or hyper vigilant or aware. And also makes you not be able to deep sleep. So being on the gas pedal predisposes you to not getting any type of repair in and being in disrepair and being catabolic, being wear and tear and breakdown. But most importantly, sexual function for most people. So to have any type of regular sexual function, you need to have a perfect symphony of parasympathetic and sympathetic balance to get any type of arousal or stimulation. You're not supposed to be aroused or stimulated when you're in a stress state because you're in survival mode. So what happens is all your arousal and your pleasure is dumbed down. So what does that mean? That means poor stimulation for sexual function. So you're probably going to have some type of erectile dysfunction, or for women, they're going to have sexual dysfunction in the same way a man would. So looking at the left side, which is the parasympathetic, that's your brake pedal. That's what you need to do to be in the repair and maintain mode. And we don't do that, especially in the military, first responders, police, fire, nurses, medical providers, or any type of professional business executive that's always on the go. They don't get into this parasympathetic brake pedal side of the house. So they're constantly in disrepair, and they're getting the same type of metabolic dysfunction as someone in the military. So this is relative to everybody. Looking at how this affects sleep and how sleep affects the metabolism and how the metabolism affects sleep. It works on a loop. But bottom line is that about 85% of service members that were studied, out of 800 service members, 85% had sleep disorders. Over 50% of those were sleep apnea. So looking at what sleep apnea does, it's involuntary sympathetic nervous system activation or overactivity. It's basically putting your body in a stress state because it's in despair. So you're not getting enough oxygen in your body. Your brain thinks you're dying. So it kicks on your nervous system to wake you up, to increase that blood pressure and get that heart rate going to keep you alive and circulate oxygen and fuel throughout the body. But what happens is if you're not getting that oxygen while you're sleeping and it's disrupted and you're not deep sleeping, you end up with all those metabolic dysfunction diseases, which also can lead to cardiovascular disease, stroke, depression, cancer, neurodegeneration, hypertension. All those things, bottom line, it causes oxidative stress, inflammation, endothelial dysfunction, which causes the hypertension, and you have all those circulatory issues in your body not getting the fuel system where it needs to go. Bottom line, sympathetic overactivity from poor sleep or obstructive sleep causes more dysfunction and more metabolic stress. Sleep disorders on the right-hand side, you'll see exactly what this means. So you got an autonomic nervous response. It signals the body, hey, you're in stress. It starts creating oxidative stress, and it starts doing inflammation throughout the whole body and causing organ damage, especially the brain and the cardiovascular system. Hypoxic ischemic brain injury. Looking at it right here, everything on the right-hand side, you see all these diseases. They're metabolic diseases. We're going to keep seeing the same ones over and over again. It's because it's caused by metabolic dysfunction. You can see on the left-hand side what sleep apnea does, and we already talked about all the environmental exposures. You add all these things on top, and then you have major disrepair and dysfunction in the body. It's metabolic. It comes down to oxidative stress, mitochondrial dysfunction. The metabolism and the nervous system are not working properly. What does it look like? So this is the person that gets about the 15-year mark in the military. Their metabolism is pretty much shutting down, and all of a sudden they start getting all these diseases that we see. When you come through the door to the provider, they're seeing these same things over and over again. Add sleep apnea on top of that, like I spoke about, all those diseases, that's what the military is spending all their money on. And that's what you see. You see the round belly, he looks skinny from the chest up and the waist down, but right in the mid band, there's a tire around the waist of fat that won't go away, no matter how much you exercise, because of metabolic dysfunction. Looking back at the environment, looking what it says, healing cycle becomes blocked by cellular miscommunication, allowing conditions like cancer, diabetes, and some neurological disorders to persist. So looking at mitochondrial dysfunction, metabolic dysfunction, what does it mean? It affects every system in the body because your cells are your powerhouse for your energy and for your reconstruction. And when these things don't get the correct programming and they're in dysfunction, you become in dysfunction and disrepair. So environmental, lifestyle, and genetic factors. Looking at oxidative stress and stress, you have the end result, chronic inflammation. Chronic inflammation leads to all your chronic illnesses. Oxidative stress, mitochondrial dysfunction. DNA disrepair, that's where your cancer is coming in, right? So chronic DNA disrepair, it builds up over too much time, and then those cells replicate as damaged. You end up with some type of cancer, cyst, or tumor. Looking at the cost of metabolic dysfunction for the lives, we're looking at 650,000 people for heart disease in the United States, 600,000 for cancer, and then respiratory disease, 150,000, stroke, 140, Alzheimer's, 110, diabetes, 80,000, influenza, 57. These are all metabolic dysfunction. This is immune dysfunction. This is chronic inflammation. This is stress. This is environmental exposures. This is trauma. All these things are, leading to these diseases. These diseases are not manifesting out of thin air. Looking at it, the cost, the financial cost, not the human cost, almost $7 billion a year for prescription drugs. And a lot of these drugs can end up causing mitochondrial dysfunction and actually disrupt metabolism even more than what you started with. Looking at it, I'm going to specifically harp on cholesterol meds. Lipitor and Zocor, they're $2 trillion in pretty much 10 years the DoD spent on cholesterol meds. So all your hormones come from cholesterol. The synthesis and breakdown and methylation for hormones depends on cholesterol metabolism. So being able to synthesize your cholesterol into hormones, and that's directly impacted by metabolic dysfunction. When you have metabolic dysfunction, you can't break down fats, carbohydrates, and proteins, create energy, and your cells can't get what they need, your hormones can't be produced, and your body starts going in disrepair and dysfunction. So the first building block of any hormone comes from cholesterol. So if you were to take something that affects cholesterol metabolism, it might affect all those other hormones coming down here in the bottom of the tree, which is pretty significant. Not even covering all the other prescription drugs that cause mitochondrial dysfunction as well. But for cholesterol meds specifically, they cause CoQ10 or deficiencies, which is huge for mitochondrial function. So looking at it, the pathway, cholesterol is the first building block for all your hormones. You disrupt cholesterol metabolism, you disrupt all those hormones. So looking at CoQ10, this is where it causes, this is the pathway of how cholesterol meds work, and this is where it stops metabolism in its tracks, right here. So statins are known to cause dementia because it's a CoQ10 enzyme deficiency. It blocks enzymatic pathways. Adverse drug reactions, we're talking over 100,000 deaths a year. This was in 2000. It's actually close to 150,000 now. Now, number 3 leading cause of death in the United States is actually adverse drug reactions and medical accidents. Looking at right here, medical errors, 251,000 with also adverse drug reactions. So healthcare systems now the number 3 leading cause of death in the United States. And then heart disease and cancer right above it. Most of these things are preventable by using precision medicine, of not trying to use the sledgehammer when we look at diseases, all these symptoms that we're seeing, but actually looking at the root cause and resolving health. So all those prescription drugs you saw in the graph before with a dollar amount to them, they're all right here, and they're the leading causes of death in the United States. The money side correlates with the death side, and it also correlates with metabolic dysfunction. So I'm going to connect the mitochondrial dysfunction and DNA disrepair into behavioral health and the suicide epidemic. But if you follow right down the path on the right-hand side, you're going to see you have your reactive oxygen, your oxidative stress, then you have your DNA damage and DNA disrepair, and then you have what's called metabolic dysfunction. And then it leads to psychiatric disorders. So not only does it lead to psychiatric disorders, it leads to cancer, suicide and cancer, both linked directly together by metabolic dysfunction of oxidative stress, mitochondrial dysfunction, metabolic dysfunction. So here's what it looks like. These are the outside causes of mitochondrial dysfunction. Glutamate excitotoxicity, that's part of lead toxicity, also part of traumatic brain injury. Glutathione depletion from heavy metals or some type of pollutant. Altered gene expression, so that's anything in your environment that can change gene expression, like radiation or any type of toxic exposure or trauma. Reactive oxygen species being increased, apoptosis. Oxidative stress, decrease ATP, and then inhibition of ionic pumps, so an abnormal calcium elevation, which is part of traumatic brain injury and lead toxicity. So all these things from the environment cause mitochondrial dysfunction, lead to psychiatric disorders, and also cancer. So two different sources, same pathways. So prescription drugs that cause mitochondrial dysfunction, I highlighted the ones in dark black right here because these are some of the most prescribed drugs within the military. But NSAIDs right off the bat, it's known that NSAIDs, they might help with pain and inflammation, but they actually don't resolve inflammation and prevent your body from regenerating tissue and bone. So taking anti-inflammatory as a temporary fix to keep you on the road march can actually prevent your body from healing, and you can cause more damage, mitochondrial dysfunction. Antibiotics, these are things you're forced to take in some areas of operation throughout the world, especially fluoroquinolones like Levaquin and Cipro. These things are known to cause mitochondrial dysfunction and damage DNA. Antidepressants, antipsychotics, all these drugs cause mitochondrial dysfunction. Again, cholesterol meds, these things are highlighted in red because this is one of the most prescribed drug on the planet, and it's also one that can cause dementia, brain damage, and cardiovascular disease because it causes inflammation and mitochondrial dysfunction. So we get the big picture here. We don't have to, beat a dead horse with this one. But if you look on the right-hand side, I keep using those two graphs, but look at the top drug sales in the Department of Defense. You're looking at all of these drugs that are linked to metabolic dysfunction. On the right, you see the causes of all this metabolic dysfunction. And then when you look at it, you can see that most of these things are preventable. Moving on to traumatic brain injury, looking at TBI. So you have rapid overpressure followed by under, and then re-equalization, the negative phase duration you see on the graph. On the left-hand side, you can see the pressure wave. That's myself shooting an M3 Carl Gustav recoilless rifle. You can see the pressure wave hitting me in the head as I'm firing this weapon. And you can see all the negative pressure pulling everything away out of the environment. Looking at it before, traumatic brain injury was only looked at as a concussive event, or you got blown up in an IED and you were jarred. It wasn't looking at firing organic weapon systems or explosive breaching or shooting certain types of heavy machine guns that cause massive overpressure and repetitive overpressure throughout the day. So going back to the drawing board, we figured out that this is causing CTE. This is causing neurodegeneration worse than we're seeing with regular concussions. So a lot of information coming out right now with blast overpressure and traumatic brain injury. So looking at the DoD, we're looking at over 2 million people deployed in Iraq and Afghanistan. And, some estimates have it brain injuries that are 150,000 all the way up to 400,000. The bottom line is there was only 3,000 and change Purple Hearts issued for traumatic brain injury when you have close to 400,000 people with brain injury. And then we have a huge population that was never evaluated or looked at for TBI. So these people were discharged out of the military without any type of proper screening. And they were, some people administratively discharged without medical benefits, and they were kicked to the curb without ever being screened. And a lot of these people, it was put off on behavioral health or PTSD. So it's all in your head, or, this is psychosomatic, or you can't be this messed up because you look fine. All these things are being told to service members that were exposed to all these things and that could possibly have brain injury. Common sense would tell us that if you're next to an explosion like this, I don't think you're immune to a blast like that. It's going to have an effect. To what extent depends on the individual circumstances. So looking at it, those are the major causes, but you know, that's traumatic brain injury. I don't like to use TBI. I like to use brain injury because the bottom line is it doesn't have to be mild or traumatic. If you have brain injury and it ruins marriages, it causes suicides, you know, it you know, causes people not to, you know, be able to work or function or have any type of sexual relationship, it's probably not mild. So all of these things, the end result is you're getting brain injury from all these exposures. Mechanism of action, we talked about lead toxicity, so I don't have to go in depth on this. If you look at it, the end result is apoptosis. So oxidative stress, DNA damage, disrepair, excitotoxicity, calcium influx, neurotransmitter influx. This is pretty much identical to lead toxicity. So it's a neurotoxic injury, ends with neurotoxicity and neurodegeneration. Chronically, it leads to encephalopathy. Looking at neuroinflammation and the pathway, this is like the chicken or the egg. So neuroinflammation can cause all those things, and all those things can cause neuroinflammation. So you have to address all of these things at the same time. You can't just keep managing symptoms. You have to put the fire out. So you have to, you know, adjust your lifestyle, and you have to adjust your diet, your nutrition, and you also have to adapt around your genetic predispositions, and you have to control your environment at work or where you're going, what you're doing. So looking at the secondary effect, I showed you guys the graph. This is it right here. It all comes down to mitochondrial dysfunction, oxidative stress, excitotoxicity, neurotoxicity, DNA fragmentation, inhibition of DNA repair. That can also lead to cancer. So, you know, having brain injury chronically or acute, that can predispose you to having brain cancer. Looking at mechanisms of action, neuroinflammation, how the brain, gut, and the immune system works. So it's been known for a long time that after a brain injury, you get gut permeability. So your gut opens up and lets everything through it that it's supposed to be blocked by your immune system. So the exact mechanism is not fully understood yet, but they know it does happen, and vice versa. When you have leaky gut, it can also cause neuroinflammation, which keeps that pathway open all the time. So having leaky gut and a brain injury can keep neuroinflammation on a constant state of your immune system being autoimmune conditions, because you're constantly inflamed, constantly have that intracranial pressure, that brain fog, the fatigue. And then with the leaky gut, you're starting to have all this immune dysfunction and skin rashes and eczema and food allergies. Your body's in override with your immune system. So brain gut connection right here with blast overpressure. But like I said before, having a leaky gut can lead to brain injury. Brain injury can lead to leaky gut. On the right-hand side, you can see that's where I had a pill endoscopy. I had leaky gut. So I had ulceration throughout my entire GI tract. And I was working as a heavy breaching instructor at a shoot house. Looking at it, you're looking at gut inflammation, and then all of a sudden your immune system goes haywire, right? All those things, when you put them in your body, whether it be all the stress, the toxins, the foods, the drugs, the pathogens, all those things are affected because your gut, your gateway to your body, your defense field, your defense force is compromised. So all those things happen on the right-hand side. Those are the symptoms you're going to see. And then they're probably going to get written off as individual conditions, and then the individual prescriptions will be written for each one of those conditions. So really important to understand how this loop works. It's like the chicken or the egg. You have to address all of them at the same time. Looking at traumatic brain injury, this is when I first went in for my NICO consult, but you can see the same thing over and over again. Symptoms progress over the last 3 years. You know, I had thousands of concussive blasts. I had loss of conscious concussions. And still at this point, it wasn't really clear of what was happening. So you're looking at these things, all these same symptoms over again. You have fatigue, you have weight gain, decreased sex drive, visual problems, balance problems, concentration, and then hormone imbalance. This is all metabolic dysfunction. This is all neurological damage as it relates to my environment where I work. Feeling fatigued, tired, headache, neck pain, vision problems, hearing loss, erectile dysfunction, all those things were a result of what was happening from where I was working. But because functional medicine was not in practice and everything was reactive medicine or symptom management or disease care, all these things weren't being looked at as far as environmental factors or lifestyle factors. Looking at them, neuro eye exams, the neurological damage was there. It was severe convergence palsy, acquired astigmatism, paresis of accommodation. These are all neurological conditions that come from neurotoxicity or traumatic brain injury. These things, are easily checked and should be part of mandatory testing. These things only take 30 minutes to look at, but has a clear picture of what someone's been exposed to, whether it be traumatic brain injury or toxic exposures, at a simple neurological eye exam. Looking at cognitive testing, neuropsych testing, I had multiple batteries done full. I think I had 6 8-hour batteries done neuropsych testing. All of it showed the same thing. They actually said I was rigid as far as my tests because they were so consistent, but everything I had been self-reporting was found after they finally did the neuropsych testing. But all my learning disabilities, problem-solving tasks, concentration, and everything I was having problems with, it was right here. But the big takeaway on this, even with all those things that were showed as cognitive impairment, I still scored above average compared to the regular Army guy or the 32 ASVAB guy. When a person goes in with a higher GT score and has a higher intelligence to begin with, a 30% cognitive deficit is still going to score average or above average compared to the regular population in the military. So we need to have some type of baseline testing to see what people were at before, because the worst thing you can tell somebody who's struggling day to day just to keep their head above water is that you're normal or there's nothing wrong with you, you're above average, when they're one bad day away from killing themselves because they think this is all in their head and manifesting all as a behavioral health problem. But when you're at 30% cognitive deficit, it feels like you're dragging a dead body and you can't do all the things you used to do. So we get paid to be special operators and perform at a high level. And to perform at optimal levels, you have to have optimal health, and that includes optimal cognitive ability. Looking at brain imaging, this image was taken at the National Intrepid Center of Excellence. This is a 2T image. All you can see is a brain. There's nothing that really sticks out. A normal MRI, unless you have an aneurysm, a tumor, or some massive trauma in the brain where you have a bleeder or something, it's not going to show anything. Maybe white matter lesions, and with a contrast agent, sometimes you'll see a tumor or a lesion. But for the most part, showing any type of traumatic brain injury or mild traumatic brain injury, you need functional imaging. A regular image right here only shows an organ, so it's not showing any type of function in the brain. Looking at functional imaging, this is a SPECT scan. So you're looking at quantitative single photon emitting computed tomography. So you're looking at blood flow and supply in the brain and fuel. So every cell in the brain, every neuron, it needs oxygen, it needs glucose, ATP. So what this is able to do is use an agent to bounce off all the cells that are active. So where you see dark colors like the dark blue, that's hypoperfusion or low activity in the brain. And where you see the high colors, that would be normal blood flow or function. So with the red arrows, you can see clear as day. Dysfunction and damage, you see lack of perfusion. The dark blue areas, traumatic brain injury, you can see the coup counter coup injury from the brain bouncing inside the skull. And those dark green areas and the frontal and parietal lobes, that's toxic encephalopathy. It looks like carbon monoxide poisoning for toxic inhalation of fumes or gases. That's what normally is seen with carbon monoxide poisoning or some type of toxic exposure. But the dark blue, again, you can see traumatic brain injury clear as day. Those are places where blood flow and blood supply is lacking. Looking at correlation with the anatomy of the brain, so knowing where the brain injury was on my brain injury, they can go and look at where the functionality of the brain is and how it's affected. And if you add some type of quantitative EEG on top of this with neuropsych testing, it all shows the same picture and all the patterns of dysfunction in the brain. But for my case, the frontal and cerebral cortex and temporal lobe is where I had the most significant damage. And that's where I'd had the most problems with short-term memory, emotion, looking at, temporal lobe, and then looking at frontal lobe, look at 13, concentration, planning, judgment, emotional expression, creativity, and inhibition. That's everything that I was complaining about right there. But you have complete correlation of damaged areas in the brain with function. Easily done, high-tech brain imaging like SARA scan with QSPEC shows this and actually gives a patient a readout of exactly where in the brain is in disrepair or dysfunction or damage. So knowing about traumatic brain injury, there's about a 3-month period after where people have persistent symptoms. And after that 3 months, you're looking at neuroendocrine dysfunction, so hormone imbalances. So this is something that's already in the literature. This is already in Department of Defense protocol. So at the bottom of the screen, you can see this is from DIVPIC. These are training slides and protocols that providers are supposed to be using with traumatic brain injury for patients after 3 months that have consistent symptoms. So you're looking at neuroendocrine dysfunction, cortisol, thyroid, pituitary hormones, testosterone, and estradiol. It says female only on this, but for men, it's also extremely important. Looking at it, once I figured out about testosterone and TBI, I actually asked to be tested in 2009. At this time, the reference range was 300 nanograms per deciliter to 1100. At this time, I was 266. So by those standards of that day, that testosterone level was that of a 9-year-old boy or a 90-year-old man. And this was a special forces operator in his 30s. So you can see already at this time, this is a non-deployed status at home, had already endocrine dysfunction. So once I figured this out, you know, the reference range, they were like, oh, it's borderline low. Well, borderline for who? And then I'm not feeling anything towards normal. Nothing worked in my body. So they weren't looking at me as a patient. They were looking at a number and trying to treat a number, not a patient. So that was problem-oriented medicine, not person-oriented medicine. Looking at how hormones work, especially in a feedback loop with pituitary hormones. So when your body senses circulating hormones and they're at healthy and normal levels, your pituitary hormones are lower levels because there's no need or demand for circulating sex hormones at a higher level. So when you see low sex hormones with low pituitary, you have a break in the feedback loop, or you've had a stress inoculated response in the body where it determines your new normal is to be catabolic or at a high cortisol load for stress, and then sex hormone goes non-prioritized. So your body being in a fight or flight response system, a sympathetic override, your body has to work off cortisol more than testosterone. So normal response to the body being stress inoculated, you work off cortisol, not testosterone. So you're perfectly wired for war, conditioned for war. Apathetic can stay deployed for 15 months, not have to worry about reproducing, having kids, or building muscle. So you've conditioned for your environment, or you have pituitary damage and there's a break in the loop. Bottom line is there's dysfunction in the endocrine system, and it's easily identified by simple testing and cost effective as well. So looking at parathyroid hormone, knowing that the function of calcium in the body and how your parathyroid works to balance calcium levels. But one of the important takeaways of this is that your body thinks lead is calcium. So if your body's flooded with lead and your parathyroid and your body thinks all that's calcium, it's going to try to protect itself. So your body's thinking it's hypercalcemic. It's going to start dumping calcium out of your body to protect itself. So what's that going to look like? Parathyroid hormone is going to be extremely elevated or borderline, but it's another feedback loop, your body trying to protect itself to keep homeostasis. So all these things work in feedback loops. You can't just look at one or two hormones. You have to look at every hormone in the entire feedback loop. So not just one hormones, all the neuroendocrine testing. So what are the symptoms of neuroendocrine dysfunction? They all look familiar: depression, emotional lability, anxiety, fatigue, poor memory, lack of concentration, right? And then reproductive function, because of low testosterone, for women, low, estrogen or low progesterone, all these things all over the map. Bottom line is it affects sexual function and fertility, and for women, their periods. So we already know what these things do. We're still not looking at them regularly to check all these things. Each one of these symptoms that you see up here usually gets labeled as its own disease, and then you get a prescription drug matched to each single one of them. So looking at that one, you see antidepressants, anti-anxiety meds, you see sleep meds, and then you see, ADHD meds. You have 4 or 5 different drugs right off the bat. On the bottom, then you're looking at HCG and Viagra. So each one of these things looked at in conventional lens is its own disease and gets its own prescription drug. Looking at them, for thyroid hormones, hair loss, anemia, all these things, constipation, cold intolerance. These are all indicators. These are check engine lights that are going off in the body that are going to get, deemed off of you're getting old, or you're going through menopause, or, you need to quit smoking. But they're not looking at these hormones. They're not looking at metabolic function. They're not looking at the environment, what's happening here. So all of these tests are easily done, ordered within existing systems, and the protocols are already there. They just need to be implemented within the DoD. Overlapping symptoms with post-concussive syndrome and neuroendocrine dysfunction, you're looking at the same hormones over and over, same symptoms over and over again for these hormone imbalances. Fatigue, poor memory, anxiety, depression, weight gain, weight loss, emotional ability, lack of concentration, attention difficulties. So this is pretty much my TBI intake of what I was telling these people, what was going on, and they still weren't looking at hormones or TBI as cause or anything from my environment causing these imbalances. So going back, no clear etiology, right? So look at the operational environment, understand the operational environment. Look at all these things, that I was doing, the places I was going. All of these things have an effect. There's an environmental effect, there's a health effect, there's psychological effects in here. You cannot go into these environments and walk away without any type of health effect. It's you're not immune to these things. If these things are in the environment and they cause those health effects, you're going to get them. But to what extent, again, goes back to those individual factors and circumstances that we talked about in the operational environment. So looking back at the intake, no clear etiology, looking back at all the symptoms. At this point in this brief, there should be no cloudy waters here. Everything should be crystal clear of what's going on with metabolic dysfunction, with toxic exposures, with inflammation. Yes, these things do cause fatigue, and that's metabolic dysfunction, that's mitochondrial dysfunction. And all of these things right here, they're not individual diseases. They're symptoms of underlying mechanisms that are in dysfunction. But all of these things are coming from the environment, the lifestyle, and the genetic predispositions. These things can be controlled and repaired and maintained by understanding these things. So having a clear operational understanding and understanding the situational context of these things, you can figure it out that it's not rocket surgery why everybody's killing themselves or getting cancer or, are overweight and can't maintain standards in the military. It's the environment. Looking at it, the patterns of dysfunction, everything on the right-hand side, you see the heavy metals, you see the TBI, you see the stress. On the left-hand side, you see it clinically. This is it right here. These are my labs. This is the metabolic dysfunction. This is the metabolic syndrome. This is the person right here who can't get out of bed and has to force themselves to do everything they used to love doing, who can't lose the weight, who has no sex drive, and has all these weird cardiovascular and lung issues going on and can't figure it out. It's right here. Simple diagnostic testing, looking at biomarkers that are widely available in existing systems already in the Department of Defense and the VA and civilian organizations. So this is it right here. These are your patterns of dysfunction. This is your metabolic dysfunction. This is the product of your environment. Going back, looking at understand the operational environment. Critical piece of understanding what is going on with a health crisis, not only in the military, but on the civilian side as well. We have to understand, the end state of what we're doing, how we're going to do it, how we're going to fix this problem, how we're going to solve it, and then looking at how we're going to implement it, and then actually, putting it into action, and then continually assessing how this environment's affecting the force, how it affects readiness, and then leading by providing empowerment and education of individuals within the system, how to repair and maintain themselves, and then how to educate and empower providers to take care of the service members. So it's all right here. This framework is already in existence. It just needs to be converted over into medicine. And looking at the operations process, you're looking at planning, preparing, assessing, and executing. All of these things can be done within medicine, and then continually assessing. You have to know readiness. And looking at the force and seeing that the health status of the force. To be able to execute missions, you have to have readiness. So it's here. Looking at it, how do we do this? I'm not going to read every single one of them on the left-hand side, but they're all right here. And it all comes down to optimizing nutrition, optimizing health, optimizing metabolism, and reducing the oxidative stress. by implementing things in diet, nutrition, and exercise that keeps that antioxidant oxidant balance in check. So we're not catabolic, we're not wear and tear, disrepair, and on the zombie cocktail of drugs being prescribed. All this stuff right here you can do without a prescription. This is education and awareness. Center of gravity analysis, you look at what we call PMECs, which is political, military, economic, and then social infrastructure and information. These are all factors when planning operations. So we talked about circumstances and factors. This is the environment. This is the lifestyle. Center of gravity goes back to the people. We have to have people filling uniforms to keep our military going, to keep our national defense, to keep the force deployed and ready. We have to have able, healthy bodies to fill them. Right now, we have almost 80% of the population ineligible to join the military. And the majority of military recruits coming into the military, they come from military families. So we have to protect that gene pool. We have to protect our humans. And then we have to put the same checks and balances as we have with our hardware, which goes into looking at the 4 steps of intelligence preparation, the battlefield again. So looking at defining the environment, right? Describing the effects. So that's all the environmental exposures. That's all the toxins, the medications. Those are all the health effects that are having on the force. And then evaluating the threat. To what extent, what type of damage are we incurring from these things? And then how do we protect people? That's your course of action development. What are we going to do to protect the force? Looking at the soft truths, the first one right off the bat, humans are more important than hardware. Well, I can tell you that it briefs well, it looks great, it sounds great, but it's completely false. Our equipment has checks and balances. It has what's called PMCS. So PMCS is preventative maintenance checks and services in the Army and preventative maintenance inspections in the Air Force. Well, what this means is that all our equipment gets checks, services, and maintenance performed before, during, and after any type of movement or before use of all types of military equipment. Most pieces of military equipment have PMCS charts used to go over every detail needed or noted to ensure the proper function of every mechanical item or non-mechanical surface. A PMCS check is required before, during, and after a piece of equipment or vehicle is used. Checks are also done at weekly, monthly, semi-annual, annual, or biannual intervals, depending on the specific part. Doing a PMCS check every time equipment is used may reduce the number of failures. This reduces the number of injuries during training exercises, improves effectiveness in combat, and increases the operator's ability to implement their equipment. So right there you have it. Our equipment has checks and balances. It has services. Our humans don't. They get checked once a year. So for example, an M1 Abrams tank costs about $4 million depending on the model. A special operator with 15 to 20 years experience, you're looking at $9 to $20 million per person for training. Well, we have one check and balance, and that's an annual health assessment, which to see if you have cancer or heart disease or HIV or tuberculosis. There are no semi-annual, monthly, annual, or biannual intervals or checks or balances or services done with humans. We are losing humans faster than we're gaining them in the military. The takeaway is that if our equipment malfunctioned as bad as our human did, the military would be non-mission capable. But since we think we can just replace bodies, as we see fit, that this problem is going to go away. It's not. We're not recruiting as fast as we're losing right now. So that's going to become a major problem here in the next 10 years. So these PMCS checks and services, we can transform this into preventative medicine checks and services. PMCS. So literally that would make your humans more important than hardware, or if not, the same relevance. So SARF attributes, looking at the RSOF core attributes, adaptability, the ability to maintain composure or responding to or adjusting one's own thinking and actions to fit a changing environment, the ability to think and solve problems in unconventional ways. Again, we have to be able to recognize, understand, and navigate multiple social networks. This is transitional into medicine as well. We have to be able to adapt to the changing environment. We have to do a paradigm shift in medicine to be more precise, to be more patient-centered, to be more resolution of health than management of disease. So looking at the soft imperatives, again, understand the operational environment and being able to, think outside the box and resolve health, not manage disease. Picture says 1,000 words. On the left-hand side, you know, you can see this is the 20 years on the gas pedal. And then you come home. On the right side, that's your name it, blame it, tame it, bill it, and refill it. So this is where you're seeing a pill for every ill. Every symptom you saw in this entire presentation gets a prescription drug matched to it. So looking at it, this is optional. I will not put this in the, the video that goes out for training, but I wanted you guys to see this for here. Read it. I'm not going to read it out loud, but it's actually pretty comical because on the left-hand side, that's from TRICARE. That's showing literally most of the drugs that are in that picture. So picture says 1,000 words. I can chop all this in. This will be in without any type of narration. This will just be up. I'll put it up on a PDF version as well so people can look at that stuff. But that's it, guys. I'm going to go in here and hopefully that recorded everything. And then we'll come back off muted now.